Hi, everyone. Thanks for jumping on today and joining me. We are going to get an introduction to substance use in pregnancy. But before we get started, I just want to introduce myself. I'm Trish, and I am a family development specialist with Catholic Charities of Kansas City, St. Joseph. I've been with Catholic Charities for almost 10 years, so I'm excited to be here today and do a little education on substance use and the health complications or health risks that it can have on a mom and a baby if used during pregnancy. So with that being said, substance use is a huge umbrella and a lot of things will fall underneath that. So in essence of time and information, I wanted to just break it down a little bit into three separate pillars underneath that umbrella and just focus on those three pillars for this presentation. But of course, just know that we're just scratching the surface here, just scratching the surface. There are a lot of rabbit holes we can go down and a lot more information that can be shared on this topic. But I just want to lay the foundation today and get started with that. So I do apologize. I know that when I reformatted some of my slides, the formatting made the slide a little wonky, so bear with me. They're still readable and still just as important, but I do know that they are a bit wonky on a few slides. So I think what we'll just go ahead and do is just get started on our presentation of substance use in pregnancy. So I'm going to go ahead and share my screen with you and pull up the PowerPoint presentation. So bear with me here as we bring this up. Okay, here we go. Oh. A lot of messages kept popping up. Sorry about that. Okay, so PowerPoint is opening and we'll get started here as soon as it pops up. There we go. So I'm hoping you can see my screen well. And so let's just get started. Let's jump right in. Substance use in pregnancy. And again, like I said, it's a broad umbrella. And we are just going to focus on three different areas today and talk about the health implications that those substances can have on moms and babies, both unborn and at delivery and even into lifetime for those children. So let's get started. Let's flip on to the next. So what we're going to cover today, the three pillars that I talked about, and I use pillars for a lack of a better word, but what we're going to cover today is smoking. And so we're going to touch on both cigarettes and e-cigarettes. We're also going to talk about alcohol. Now, I didn't break down alcohol into any certain type, such as like liquors or wines or beers. We're just going to do all-encompassing alcohol in general. And then the last section we're going to touch on is drugs. And I have broken that down into three different ones: caffeine, marijuana, and opioids. So let's get started with smoking. The important thing to remember with smoking is that if you smoke, your baby smokes. And if you are breathing in secondhand smoke, your baby is also breathing in secondhand smoke, both while they are in the womb as well as when they are here with us and in your home. So just remember that that secondhand smoke is also impacting baby. Smoking does present some complications during pregnancy. And let's go through those complications here. And I'm going to do a brief description of each one so we're all on the same page as to what they mean. So a miscarriage, and I know that we hear a lot about women having miscarriages, and but for those who don't know specifically what that is, a miscarriage is the unexpected loss of a baby before the 20th week of pregnancy. So a miscarriage will often occur when because the fetus isn't developing normally. And a miscarriage can not only be physically painful for a woman, but it can also be emotionally painful. I mean, they've lost their child. So The next one is ectopic pregnancy. And an ectopic pregnancy is when the fertilized egg does not plant within the uterus. So the uterus is where the baby usually develops. So in an ectopic pregnancy, that fertilized egg implants outside of the uterus, and the result is most often a miscarriage. Now, the next few, if I mispronounce, please forgive me. But the next one we're going to touch on is placental abruption. And that is, okay, so the placenta provides oxygen and nutrients to the baby. And so when the placenta, this placental abruption will happen when the placenta separates too early from the uterus, and this can cause bleeding in the mother, and it can also lower or stop the baby's supply of oxygen or blood. The next is placenta previa, and again, I apologize if I've mispronounced things. This is when the placenta covers the cervix, which is the lower end opening of the uterus. So the placenta covers the cervix. It can cause severe bleeding during pregnancy and during delivery. The next one is preeclampsia, and this is when mom is experiencing high blood pressure, and she will also experience swollen feet, legs, and hands. This can have severe complications for both mom and baby, such as a placental abruption, again, where that placenta separates from the uterus too early, and can also have complications such as having a premature birth. And lastly, the last complication during pregnancy that smoking can have on you and your baby is a preterm birth. And this is when the baby is born too early. Babies who survive delivery can have problems breathing, they can have digestion issues, and they can have bleeding in their brains. So as the child gets older, he or she may experience developmental delays, which they may fall behind in language, thinking, or movement skills. And that will definitely have an impact on their success in school. And according to the Drug Abuse While Pregnant of 2013, tobacco users have a 1.8 to a 2.8 times greater risk of having a stillbirth versus those women who do not smoke during pregnancy. So let's take a minute to talk about e-cigarettes or electronic cigarettes. Now, I have heard, well, they've been around for years, and I've heard people say they smoke them to try to quit smoking cigarettes, or they smoke them because they're less harmful than cigarettes. So there's just not a lot of evidence out there right now to show whether or not e-cigarettes truly help people quit smoking. But the thing to remember with e-cigarettes is that they still contain nicotine, just like cigarettes. So they contain nicotine, flavorings, and other chemicals. And so while e-cigarettes generally have fewer harmful substances than like cigarette smoke, e-cigarettes still contain nicotine, and nicotine is still not safe to use during pregnancy. Nicotine is a health danger. It's a danger for pregnant women and for their developing babies. And again, if mama's smoking, baby is smoking too. If mom's inhaling the secondhand smoke and the chemicals in the secondhand smoke, baby is inhaling that also. So let's address some of the benefits of quitting smoking before actually giving birth. So studies have shown that quitting smoking before you give birth, there's actually a less risk of preterm birth. There is a less risk of birth defects. There is also an increased chance of baby having a healthy birth weight, and that their future growth and development will also be on track. They will more likely come home from the hospital with you. So remember when I said one of the health complications of smoking during pregnancy is that a baby could come preterm. It could come early. And there are some issues that come along with a baby being born too early. their organs haven't developed completely. So in those cases, the babies will have to stay behind and get in a safe environment and get the medical treatment and care that they so desperately need. I can't imagine the heartbreak of not coming home with my baby. So quitting at any time during pregnancy really can have an impact on those health implications, excuse me. So there's this increased chance that your baby's lungs will develop. You will be more likely to have the baby will be more likely to have normal brain development before birth and even throughout early childhood. And baby will be less likely to die from sudden infant death syndrome. All very important reasons to stop smoking while pregnant. So while I was doing some research on this topic, I came across an article that talked about the myths versus the facts of smoking. And there were many of them listed in the article. And I picked 4 of them that I have heard before. So I just kind of wanted to address them. And I think each myth, the fact related to each myth really hits home the importance of quitting at any time. So let's jump in and just start with myth number 1. So myth number 1, I'm pregnant and smoking, so there's no point in quitting. But the fact remains that quitting at any stage of your pregnancy truly has health benefits, not only for mom, but also for baby. So whether you quit smoking month 2 or month 7, the important thing is that you've quit smoking. Myth number 2, quitting will be too stressful for the baby. So quitting does not put extra stress on baby. Quitting is, in fact, one of the healthiest things that you can do for you and baby while pregnant, and even after baby is born. Myth number 3, smoking fewer cigarettes or smoking e-cigarettes while pregnant is okay. The fact remains that there is simply just no safe amount of smoking. Each puff of a cigarette or each puff of an e-cigarette releases harmful chemicals. And please remember, e-cigarettes still contain nicotine, just like a cigarette, and that nicotine is harmful to baby's development. And lastly, myth number 4, I smoked during my last pregnancy and had a healthy baby. So every time you smoke, you are putting your baby's health at risk. So even if you had a healthy baby previously and you smoked throughout the pregnancy, there just simply is no guarantee that the same will hold true in the next pregnancy. So there's just no guarantee that you will continue to have healthy babies if you continue smoking. So you're interested in quitting. If you're interested in quitting smoking, and this can apply to anybody, not just necessarily mamas who are having babies. Here is a wonderful resource that I want to pass along to you. It's called 1-800-QUIT-NOW, or 1-800-784-8669. So little side note, when I hear 1-800-QUIT-NOW, I always have one of those infomercial jingles in my head. So whatever it takes to remember this phone number and have it be like an earworm, I guess, where it's hard to shake out of your head. But as long as you remember it when you are needing it, that's the important thing. So the great thing about this resource is it's free. It is so free. And the other great thing is that you're going to get a human being on the other end of the line. And these coaches can help offer tips and advice and resources to you regarding quitting smoking. And they can also help you make a plan to quit. I think sometimes asking for help, it's a hard thing. We all, most people struggle with asking for help in their time of need. I think sometimes getting help from a neutral third party is a wonderful option. And and it's free. So it's just a great resource to have. So if you're interested in quitting smoking and you're interested in learning more information about all of that, give 1-800-QUIT-NOW a jingle and see how they could help you out. So that kind of wraps up the smoking pillar underneath the substance use umbrella. So right now, let's move on to alcohol. And again, I mentioned that I did not narrow this down to any specific type of alcohol. So we're not going to talk specifically about beers or liquors or wines. We are just going to include it all as in one big lump of alcohol, right? So the thing to remember with alcohol is that there's just simply no safe amount to drink when you're pregnant or when you're trying to get pregnant. All types of alcohol are equally harmful. So let's look at some of the risks that are involved with alcohol use during pregnancy. So one of the risks we have is miscarriage. And again, that is unexpectedly losing your baby before 20 weeks, a stillbirth, a premature birth. Your baby can develop heart defects from mom drinking while she's pregnant. And fetal alcohol spectrum disorders, which impact behavioral, physical, and intellectual abilities. In the next slide, I'm going to highlight some of the characteristics of the fetal alcohol spectrum disorder, so you know a little bit more about what that is involved. But as I said, with alcohol, all types of alcohol are equally harmful, and there's just simply no safe amount to drink while you're pregnant. And I guess, like we said with smoking, you know, if you're smoking, baby's smoking. If you're drinking, baby is drinking also. So just keep that in mind. So the next slide is the fetal alcohol spectrum disorder, some of the characteristics. Now, before I go through this list, I want to say that this is not a comprehensive list. This is a partial list, but I pulled these out from the research so that I could put them on here. But there are other characteristics. I kind of just wanted to give you a good launching pad with the fetal alcohol spectrum disorders. So let's start at the top. Abnormal facial features. Children with fetal alcohol spectrum disorders can also have a smaller head than for their age, than their peers. They can have poor coordination, low IQ, poor memory, difficulty paying attention, speech and language delays, learning disabilities, which will in fact impact their success in school. They may experience vision or hearing problems. They may have problems with heart, kidneys, or bones, and they may have a low body weight. I think the thing to remember when you look at this list for fetal alcohol spectrum disorders, these aren't just health implications that are during pregnancy, and they're not just health implications at delivery. These are health implications that are going to follow that child throughout their entire life. So please bear in mind that these are some of the impacts that drinking alcohol can have on a child, a baby, before it's born, as well throughout their lifetime. So for anybody who's looking to get help for stopping drinking, you know, just please know it's never too late to stop. For pregnant women, the sooner the mama stops drinking, the better it will be for both her and baby. So one thing I encourage everybody to do, especially pregnant women, is to talk to your healthcare provider. And I know that talking to your healthcare provider about perhaps addiction issues can be a huge ball of wax and can be very uncomfortable and scary and anxiety provoking. But your healthcare provider is there to work as a team with you, and they want you to be healthy. They want your baby to be healthy, and they need to have an awareness of what is being put in your body and the effects that that could have on your baby. So please talk to your healthcare provider if this is a concern. If you would like to find a treatment facility to help with any addiction, both either inpatient or outpatient, on an inpatient or outpatient basis, excuse me, you simply can go to findtreatment.gov, G-O-V as in Victor, and you can just plug in a zip code and it will pull up a list of facilities in that zip code or near that zip code. One thing that I would like to suggest is that, have a list of questions for facilities, because not all facilities are created equal. Some will accept one type of insurance and then the next one will not accept it. So there are some definite questions that you'll need to ask about the facilities. And as I was thinking about this in preparation for this presentation, I thought that would be so scary. To have to do all this, and overwhelming too, to have to do all this on your own. So if you have a family member or a friend or a neighbor or a colleague, just somebody in your world that will be supportive of you, consider asking that person to walk beside you, to be a part of this, to help be a person, to help ask the right questions, or to be that extra set of ears to hear what people have to say. And truly, I would hope that that wouldn't make you feel as alone in this process. So I just encourage that if you feel like, inpatient or outpatient treatment is right for you at this time, please just find somebody who can be your cheerleader and be in your corner to support you through all that. And hopefully that will lessen some fears and anxieties for you. To find a local Alcoholics Anonymous chapter, there's also a website for that. So you can go to aa.org, O-R-G. And again, you can just plug in your zip code and it will pull up chapters or meeting times within that zip code or surrounding zip codes. Just another way to help get the support you need if you're looking at quitting drinking. So let's move on to the third and final pillar that I mentioned. And this one, we're going to start off with caffeine. So caffeine is a drug. It is a central nervous stimulant. And I think when we hear caffeine, we think mostly coffee and tea, energy drinks maybe, but chocolate, soda, some medications also contain levels of caffeine in them. Because it is a central nervous stimulant, its main job as a stimulant is to keep you awake, give you energy, keep you moving. So while not a lot of research has been done on caffeine's effects on baby while mom is pregnant, they do suggest that it is still best to limit your daily caffeine intake to no more than 200 milligrams of caffeine a day. So how much is 200 milligrams? It is 12 ounces of coffee, which is like a cup and a half of coffee a day. So if you're a coffee drinker, you might want to drink that in the morning and just be very mindful of the caffeine intake that you may have for the rest of the day. But certainly it's something to pay attention to. Caffeine does have some effects on the body, and we all may have experienced this at one time or another. Caffeine can cause an increase in your blood pressure. So while it may be a short-term increase in your blood pressure, it can also lead to a long-term increase in blood pressure. It can lead to an increase in your heart rate, and I think this is what we commonly hear as my heart is racing, or I feel jittery, or I feel like I have heart palpitations, my heart's skipping a beat. those kind of things. And those are scary things to experience if you've ever experienced things like that. So please remember that caffeine can have a direct impact on your heart rate and cause it to increase. Caffeine can also interfere with sleep. And it can cause insomnia. So the thing to remember too with caffeine is some people are more sensitive to caffeine than others. I personally am not as sensitive to caffeine. I could probably drink a pot of coffee before I go to bed and sleep soundly all night long. It's just never had an impact on me like that. But the next person, their experience may be the complete opposite, where they needed to drink that coffee first thing in the morning. So just be aware that if caffeine doesn't have that impact on you, it doesn't mean it's not going to have the same impact on the next person. It's just going to affect us all a little bit differently. Too much caffeine can lead to headaches, especially if you're taking in high levels of caffeine and then you start to wean yourself off of it. They suggest that if you're doing that, to gradually wean yourself down off of the caffeine instead of just kind of making a big jump all at once, because then you can start to have headaches. And then caffeine is a diuretic, and I didn't realize this. I did not know this until I did the research for this presentation, but caffeine is a diuretic. So the more caffeine you're taking into your body, the more often you're going to have to go to the bathroom. So let's go on to marijuana. Why did I include marijuana in this presentation as opposed to all the other drugs that are out there? Well, marijuana has been a national topic for a while now, and its use is growing. Many states have legalized it. Many states may be moving in that direction. So I think it's a really important conversation to start to have. And so let's just kind of talk about some of the facts related to marijuana use and pregnancy. So marijuana may increase the baby's risk of developmental problems, which will have an impact on their attention and their ability to learn. 1 in 25 women do report using marijuana while pregnant. The chemicals in any form of marijuana may be harmful to baby. So let's kind of dissect the sentence a little bit. So the chemicals, I'm referring to THC. So THC in any form of marijuana, and by any form, we're talking also about whether you're smoking it, whether you're ingesting it through an edible, or if you're putting it in brownies, in food, any form is equally as harmful to the baby. So just by eating an edible doesn't mean, oh, it's not going to be as harmful as smoking it. That is not true. It still has the chemicals. The chemicals in any form are still going to be just as harmful to you and baby. So there is a 2.3 times greater risk of stillbirth among women who smoke marijuana during pregnancy as opposed to women who do not. But more research is needed to better understand the effects of marijuana use during pregnancy. And you know, when we do research, like scientific research like this, we need years and years of studying and follow-up and data. So it's understandable that we need to continue to do more research on this topic. One thing that I do want to recommend, that if you are using marijuana while you are pregnant, to speak to your healthcare provider. And again, I know that's probably a conversation that you do not want to have. There could be fears involved in that. Will they take my baby from me when my baby is born? You know, well, I can't foresee future for anything. Your healthcare provider still needs to know what's going into your body, because of the health implications that has on you while you're pregnant, as well as on your baby while it's developing in the womb, as well as when baby decides to make its grand appearance into the world. So it's a difficult conversation, but it's a vital conversation. So please consider speaking with your healthcare provider if you are using marijuana while you're pregnant. So let's talk about opioids for a couple minutes. Again, I picked opioids because we've been having a national opioid crisis for years now, for a few years now. And so we've probably heard about it either personally or in the news, or I've read articles or reports on it. So there's probably tons of information out there in the world on this. And again, just doing very surface level information. But what are the opioids? What are we even talking about when we're saying opioids? Well, they're prescription pain medications. So things like, and I know we've all heard of OxyContin, oxycodone, morphine. Opioids also includes heroin and fentanyl. Opioids cause a significant health concern for women who are using while they're pregnant. And according to the Centers for Disease Control, the CDC, between 1999 and 2014, the number of pregnant women with opioid use disorder at labor and delivery quadrupled. It quadrupled. That is an extremely sobering and stark statistic. The use of opioids while pregnant is linked to some very serious health outcomes for mom and baby. And so let's kind of go through those here. Preterm birth, stillbirth. Women who use opioids during pregnancy are 2.2 times at greater risk of having a stillbirth than women who do not use opioids during pregnancy. Opioid use is linked to maternal mortality and is also linked to neonatal abstinence syndrome. And you might be thinking at this very moment, hey, Trish, what is neonatal abstinence syndrome? And it is a group of conditions that is caused when a baby withdraws from certain drugs they're exposed to in the womb. It's often caused when a woman takes opioids during pregnancy. There was a statistic that I jotted down earlier today regarding neonatal abstinence syndrome and the rate of mortality. And this is a bit stark also, heartbreaking. The rate of mortality among babies with neonatal abstinence syndrome, the rate of mortality is 63.63 per 1,000 infants. And that is compared to the rate of mortality with children who do not have neonatal abstinence syndrome. Their rate of mortality is 17.29 per 1,000 infants. And I'm sorry I didn't get that on the slide. I just ran across the statistic this morning. But again, rate of mortality among children with NAS is 63.3 as compared to 17.29. And that is a stark, heartbreaking statistic. So if you are taking opioids and you need some help, 2 suggestions that I have. The research tells us do not stop or start any opioids on your own. Do not start or stop on your own. This is a vital conversation that you need to have with your healthcare provider. And again, I know conversation is going to be uncomfortable and hard and scary and stressful, but it is the best conversation that you could be having. You need to have that with your healthcare provider. Your healthcare provider can work with you to assess the risks and to help you develop a plan that is going to be safe for you and for baby. And just remember, your healthcare worker or your healthcare provider is there They want their best interest. You are their best interest. They want you to be healthy. They want you to be safe. They want baby to be healthy and safe. So these are conversations that are extremely vital. And with the opioid crisis in America and these statistics regarding usage and the rate of mortality among the babies, it's definitely a conversation that needs to happen if you are using and pregnant. So we've reached the end. So, if there's anything that I want you to take away from this today, like I mentioned, it's a broad umbrella. Substance use is a broad umbrella, and we could focus on one area and spend hours talking about it. And but for the sake of this presentation, we just simply couldn't do that. So what takeaways do I have for you? Or I hope that you're taking something, just a glean of information away from this presentation. So please just remember that substance use while pregnant poses significant health concerns for both mom and baby. And these health issues are concerning both while pregnant and after birth. And remember, especially with the using alcohol while pregnant, those health complications on baby can last their entire lifetime. So please remember, it's just not while you're pregnant and just not at delivery. It can be a lifelong impact on the baby. Please remember, it's never too late to stop, never too late to stop, and reach out for help. Asking for help is one of the hardest things that many of us will ever do. But trust and know that there are people out there who want to walk beside you, who want to support you, who want to see you succeed. So if you're at that point and you're ready for help, do not hesitate to reach out to the people you need to reach out to. They're there to support you and help get you through this. I'm going to stop sharing my screen if I can figure out how to do that. I don't know if I can figure out how to do that. So anyway, I guess if I can't get my screen to stop sharing, I just want to say thank you so much for, oh, maybe. There we go. Oh, I figured it out. Sorry, technology is not my friend most days, but thank you so much for being here and for listening in on this very important topic of substance use and pregnancy. And please just know that people care and really want you to be healthy and want your baby to be healthy. And if you're needing assistance or you're ready for help with all that, please do not hesitate to reach out. There are people there that are ready to support you through all that. So again, it's been wonderful. Thank you so much. If you made it this far, kudos to you. So thank you so much. I wish you all a very safe and healthy rest of the day, and take care. We've got winter weather here in Kansas City, so just be super safe when you're out in this weather if you're here in Kansas City or anywhere. Just be safe. Stay safe and healthy, everybody, and I will see you on the flip side. Take care. Bye-bye.